introduction, our topic is Guillain-Barre Syndrome in a pediatric patient. So I'd like to introduce you to the cast of characters. This is nurse practitioner Mario Poppins. He's going to be married, but we couldn't get a girl, so he's Mario. This is Mrs. Shaw. She's the mother of the patient. She's a teen mom. She is graduating high school this year, though. This is Georgette Bernard Shaw. That's GPS. And she's a patient. And then this is another little character who will do some education. She's about 4. Yeah, Mom had her when she was about 14. So, yeah. So, the center scene. This is the hospital room, and we're going to start with Mrs. Shaw, and we're going to come back here behind me. We're going to start with Mrs. Shaw and Georgette, who are at the doctor's office.
Can you breathe, honey? Can you breathe, honey? Turn towards me. What's wrong?
Mom, I can't get enough air in my face. Feels funny. I can't swallow, and my throat is tight.
Don't worry, dear. The nurse practitioner is going to come and tell us what's wrong. Come in. Hello. My name is Nurse Mario Poppins, and I'm going to be your nurse practitioner today, taking care of you. How are you? Not so good. Well, okay. Now, I just want to go over some of the things that we talked about. On examination, I found the left side of her face has paralysis that we call veil holding. She has a hard time breathing. Her throat is swollen, and she has a hard time swallowing. When we examined her legs, we found that the reflexes are slow, and she has some numbness. Her blood pressure and heart rate are high for her age, and in the lab results, we found blood protein in the cerebrospinal fluid than we should. Also, her white blood cell count was lower than it should be, making Georgette vulnerable to infections. The bacterial and viral cultures were negative.
All right, freeze! The findings here are consistent with Georgette having Guillain-Barre Syndrome. This disease has a typical progression of symptoms that we can follow and a good prognosis for recovery. Some of the classic signs and symptoms seen with Guillain-Barre are sore throat with rapid or gradual onset, muscle tenderness, ascending muscle weakness that may progress to paralysis. Tendon reflexes are depressed or absent, and they may have paralysis or seem flaccid. Breathlessness and shallow irregular respirations are normal in this condition, with varying degrees of sensory impairment. Lower limb and back pain are common, urinary incontinence or retention, and constipation also occur. Abdominal pain and fatigue, orthostatic hypotension, or feeling faint with change of position can cause bradycardia or even heart block. Let's go and let Mrs. Shaw and Nurse Poppins get back to what they were talking about. On freeze!
She has had lots of symptoms you talked about, nurse. What is going to happen to my poor Georgette? I'm so worried, Nurse Poppins. Please tell me all the things that are going to happen to her in the hospital.
Well, we are going to admit Georgette, and this is what's going to happen. Because her breathing is affected, we may help her with a ventilator. She is going to be put on a regimen of medications specifically for her problem. We will insert an IV to help give her special medicine, and she will get better. It is called IVIG, which stands for intravenous immunoglobulin. This is a blood product we give people to help boost their immune system. We may also give her steroids to help reduce inflammation. It's also possible the doctor may order plasmapheresis to help clean out the toxins in her blood, but it can cause high blood pressure and fever, so we will watch her closely. The recommended treatment is administered within 2 weeks of onset, which is within our time frame now, and is more cost-effective.
Breathe. The nurse taught me about heparin, which may be prescribed to prevent deep vein thrombosis or blood clots from her paralysis. Nurse Poppins mentioned that my Georgette may also need stool softeners to prevent constipation. I was worried about Georgette's pain, and the nurse explained they could use pain medicines like acetaminophen if they were needed, and a histamine antagonist like capsaicin to prevent ulcer formation and protect her stomach. Nurse Poppins said, chronic neuropathic pain sometimes happens with GBS and may be treated with gabapentin, which does have some side effects to watch for with extreme mood changes, nausea, vomiting, and dizziness. She said we would discuss all Georgette's medicines to make sure there would be no interactions between the stronger pain medicine and any of the Tylenol, Capsule, or any others. Carbamazepine is another medicine that the nurse told me that the doctor may prescribe. With this one, we will have to watch her liver function. With either of these medicines, I have to make sure my daughter keeps taking the medicine that's prescribed or she could have seizures. Once the acute phase has ended and she's recuperating, we will work with her on physical therapy, occupational therapy, and speech therapy to help overcome some of the weaknesses that GBS can cause. I was really glad the nurse explained everything so carefully to me. It helped me feel much more relaxed during this scary time.
Mrs. Shaw, can I tell the boys and girls something important about Guillain-Barre?
Sure.
Well, the emphasis of Georgette's care is on close observation to assess the extent of paralysis and on prevention of complications of paralysis, including aspiration and choking, atelectasis of her lungs, deep vein thrombosis, pressure ulcers, fear and anxiety, autonomic dysfunction, and pain. Okay, let's breathe.
Mrs. Shaw, please trust that we are going to give Georgette the very, very best care possible and make sure she gets better. We will carefully observe her possible difficulty in swallowing and respiratory involvement. We will help keep the oxygen source, bag of masks, endotracheal tube intubation, and suctioning equipment, tracheostomy tray, and vasoconstrictor drugs nearby. She is going to be on continuous pulse oximeter to tell us how well the oxygen is getting to her tissues. We're going to monitor her vital signs frequently, including neurological signs and her level of consciousness, to tell us where in the progression of the disease she is and when she's getting better. If she has oral or pharyngeal involvement, that could require NG or tube feeding. If that is the case, we're going to watch for proper gastric and clean constipation. We're going to watch how much fluids go in and come out. If we document symptoms of urinary retention, that could require catheterization. Because we know that Guillain-Barre syndrome causes immobility, this is going to require meticulous skin care. Passive range of motion exercises are very important if Georgette has any muscle weakness or paralysis to prevent contractions, which are very painful and can permanently shorten her muscles and limit her flexibility. Deep vein thrombosis or blood clots may be prevented with anti-embolism stockings or devices and blood thinners that the doctor will order.
Okay, everyone, breathe. The main thing the nurse taught me about was my part in helping Georgette's recovery from GBS and prevention of contractures. She emphasized that a really important thing I could do was to learn these special exercises called range of motion that I could do every day to help her. The nurse Poppins definitely encouraged me to provide lots of parental contact to reassure Georgette through frightening interventions like ventilation and tube feeding with lots of eye contact and hugs and kisses. Nurse Poppins made very sure that I understood that he would be with us every step of the way to help us through this support. This is paramount to good treatment. This disease is very hard on kids and their families.
As we go through our procedures, we will teach you, Mrs. Shaw, to be able to recognize the signs and symptoms of pain, how to take care of the G-tube, and those passive range of motion exercises we talked about that you can do at home. I know we have covered a lot of information on Mrs. Shaw, and I understand it is a lot to take in at once, but please feel free to ask me any questions and clarify at any time. For right now, Mrs. Shaw, do you have any questions for me?
Yes, I was thinking, how do you think she got this disease? Is it contagious? Is there any way I could have avoided this or avoided it in the future?
Well, thank you for asking. Guillain-Barre Syndrome is an immune-mediated disease associated with a number of viral or bacterial infections or administration of vaccines. But we don't have a definitive cause. It is associated with infectious mononucleosis, measles, mumps, Campylobacter jejuni, cytomegalovirus, and H. pylori, which is a stomach infection. This definitely coincides with your history that Georgette had the flu a couple of weeks ago. It could not have been prevented, Mrs. Shaw. It is not contagious in itself. However, we're going to watch her immune system, so we do want to observe good hygiene and hand washing in support of her recovery.
All right, you guys, breathe. There are some specifics about GBS that are important for everybody to understand. GBS has a progression of 3 phases with ascending paralysis and descending paralysis in the recovery. The first stage, which Georgette is in now, is the acute or progressive phase and begins with the onset of symptoms and continues until new symptoms stop appearing. The second phase is the plateau stage, when symptoms remain constant without further deterioration. And the third phase is the recovery phase, when Georgette will begin to improve and progress towards recovery. Now, back to the story. Breathe.
How are we going to handle her schoolwork? I don't want her to fall behind, nurse.
First, she is going to go through her acute and then plateau phases.
Mommy, I don't like school.
Oh, okay. When Georgette is in the third stage, the recovery stage, we can start the occupational therapy as she can tolerate it to get her back up to speed as best she can with the normal activities of daily living and schoolwork.
I want to dance.
Of course you do, Georgette. Please be aware, Mrs. Shaw, this is not going away in a week. We will be working with you and Georgette and a team of professionals, so every member support is very important. Because Georgette is only 4 years old, we will take into consideration her developmental level to alleviate her 4.5 to alleviate her anxiety. We will talk to her at her level and explain procedures before we perform them and act them out so she can always feel safe and secure.
Will it hurt?
We'll do it more. Sometimes it will, but we'll be with you. Being with you, Mom, will help alleviate her separation anxiety and will also having her siblings and family visit her.
Don't leave me, Mama. Oh, no, I won't.
Will definitely help her to feel more comfortable. It is definitely going to be emotionally a hard time with the shock on all the family members. But everyone on Georgette's team, including all of the family, will benefit from repeated assurance that recovery is occurring, and we are going to provide realistic information regarding the possibility of any residual permanent disability.
Darling, do you have any questions for Nurse Poppins?
Yes, Nurse Poppins, will I still be able to dance in my pretty pink tutu?
Well, Georgette, all of the people here at the hospital and at home are going to do their very best to take really good care of you. If any of your muscles have any problems from this Guillain-Barre after you start to get better, we will let you know every step along the way. I can't promise there won't be any problems, but most children have a complete recovery from this disease.
That's good.
I can promise we're all going to do our absolute best to help you through this and explain everything along the way.
See, kiddo, you're going to be all fine. Don't worry.
Thank you, Nurse Poppins.
Yay, Nurse Poppins. Yay, Georgette. Thank you so much, Nurse.